Now we're ready to begin the assessment of the superficial femoral artery. I'm going to ask Julie to identify the common femoral artery bifurcation again, so we have a place to start and we can reorient our positioning. And she's at the common femoral artery bifurcation and the superficial femoral artery. I'm just going to make a slight adjustment in my color scale because I'm seeing a lot of color aliasing, which I want to eliminate.
Good call.
Yeah. So we're going to visually inspect the superficial femoral artery. You can scan distally and look for areas of color flow turbulence. These would be areas of interest where you would want to sample for a velocity measurement. I'm going to take a representative velocity measurement in the proximal superficial femoral artery.
That was a good call on the beam steer.
Velocity is 81 centimeters per second with a normal triphasic waveform.
Now let me just see what the B mode images look like, since he's nice and young and has beautiful anatomy.
We wouldn't expect to see any plaque, correct?
Absolutely not.
And we don't. The vessel is nice and clean, free of any echoes.
And it's important to document your B mode imaging, your color flow Doppler imaging, and your spectral Doppler tracings in each region of this vessel. Now that we obtained our peak systolic velocities from the proximal portion of the superficial femoral artery, I will begin to scan more distally to the mid and distal region of the superficial femoral artery with my color Doppler activated.
Julie's going to inspect the superficial femoral artery with her color Doppler, looking for areas of flow disturbances or color aliasing, which might signify pathology within the vessel. And as she scans distally, you'll notice that the vessel will begin to dive deep as it approaches the Hunter's Canal.
And the Hunter's Canal is about distal thigh knee area on a patient.
And at this level, we're actually losing our color flow, filling. So there are some things that you can do to improve. One of them would be to center steer. Anytime you get to a depth of 4 centimeters or greater with this type of transducer, you will begin to lose the penetration and the power of your color Doppler. We have the option to lower our frequency, which will give us more penetration and color filling.
Oh, that looks great.
We can also increase our color gain.
Yeah, I like that.
And one more trick, we can reduce our wall filter so that we get more edge-to-edge flow. That looks nice.
Beautiful.
I'm going to turn the color off, and now Julie's going to visually inspect the vessel in grayscale, B mode, following it from distal to proximal. And we're going to end up pretty much in the same location that we started, where we can begin the spectral Doppler analysis. Now, don't be afraid to go back to your transduce orientation if you do lose sight of your vessel, as Julie is doing now. The transverse view will always give you the overall lay of the land, and you can identify your anatomy. And remember that spin technique that we talked about at the common femoral artery bifurcation. And she is pretty much back to where we started from in the proximal thigh.
Let's obtain some peak systolic velocity measurements from our mid and distal region of our superficial femoral artery. That's beautiful velocity of 82 centimeters a second. All right, let's go ahead and get our distal one. Scroll down distally.
Would you like some color to help?
Sure.
I'll center steer my box.
Thank you.
And I'll even invert the color so that we have our arteries red.
I like that.
And I'll turn the color off.
Beautiful.
And I'll sample.
All right, let's make sure we beam steer that appropriately. There we go. Nice job. You should come by our lab and scan with me more often. It's great, 56 centimeters a second.
In the event that you have difficulty visualizing the distal part of the superficial femoral artery, don't forget about our other transducer that we talked about earlier. The curved linear which will allow you increased penetration and visualization of the deeper vessels.
Ah, that is gorgeous.
I bet you could follow that all the way to the popliteal artery.